Hi, welcome back to my channel. This is MJ, the coding coach. Thank you for joining again. Excuse me. And as you look at this video, and if it's helpful for you, or if you find things that you like about it, or whatever, if you find yourself just constantly looking at my videos, make sure you like, comment, and subscribe. Make sure, if nothing else, that you comment and let me know what type of videos you're looking for, what kind of help you need, things like that. So today's video is going to be about guidelines. Guidelines are so important to coding. Now, there are only about 10 questions on the CPC exam regarding guidelines. But when you get into real live coding, real life or real live coding, then guidelines are going to be very important to you being efficient and accurate when coding. So if you're a coding student now, or if you are just finished and or whatever the case, a person who has a coding job, who's been coding, is not in school, who does this for a living, we will tell you guys that coding in school, taking a coding course and learning is totally different from real life coding. I can just tell you one of the differences. And when I tell you one of the differences, you're going to be like, you know what? Say no more. Understand it. So, one of the differences is when you're in school and when you're doing your coding course, then you're going to have multiple choice. You're going to have multiple choices. The teacher is going to ask you something. You're going to have quizzes, and it's going to give you A, B, C, or D. Well, when you're coding in real life, there are no multiple choices. You're going to have to be able to read the medical chart, and upon reading the chart, you're going to have to be able to find the diagnosis just by reading the medical chart. Finding the CPT codes just by reading the medical charts. Finding the HICPIC codes. There are not going to be any multiple choice. So today's video is going to be about guidelines. Make sure now you do know that you can write in your book. And if you're a potential coder or thinking about coding and you don't know everything, you can use your books for the exam. Nobody expects you to know all of the diagnoses that a person can be diagnosed with. Nobody expects you to know all of the procedures or services that a physician can perform. Nobody expects you to know all the injections and vaccines and supplies from medic. Nobody expects you to remember all those. It's just too much. So you can use your books for the exam, in case you didn't know. So make sure you write in your books as well. You can write notes in your books. Actually, there is a section for notes. Give me a second. Let me slide off. I think I have one of my old books here. So this is one of my old books. One of my old books. So I wrote notes in here. And let me show you guys. Okay. So here, you see, it's a section that says notes. So as you can see, notes. So utilize your notes section in your book. So today we'll talk about guidelines. We'll go over some guidelines. I'll give you a little extended information, little details about some things, and hopefully you will find this helpful. Make sure you write in your book. A lot of these guidelines that we're going to discuss today on this video, a lot of these guidelines that we're going to discuss on this video, they're going to be replica questions like this on your exam. So please take this video, listen, trust me. I'm not just saying this so you can watch my video. I want you to watch it. I want you to subscribe. I do want you to comment, but I'm not just saying it for those purposes. I'm trying to help you out. I have my CPC. I'm trying to help you get yours as well. So listen to me. Listen to me. So what I'm telling you in this video, please play this video, write it down, pause it, take a screenshot, do whatever you have to do. Write these notes in your book. And then when you take the exam, I want you to come back to the same video up under the comments and tell me, MJ, the coding coach, you said it. These same questions were on the exam. I'm glad I wrote it down. Mark my words. Okay. So, first question. And I got some flashcards here. So if you see me looking down, I kind of wrote some flashcards and I got some notes and things I typed up and things like that. So, guidelines. First question. What codes, according to ICD-10 guidelines, describe a patient that has hypertension with left heart failure? I'll read it again. What codes, according to ICD-10 guidelines, describe a patient that has hypertension with left heart failure? I just told you that you won't have multiple choice, but I got you some. Since you're in school or thinking about it, or you may need the extra help, we're going to do multiple choice on a few of them, and then I'll kind of go into detail. So, you're going to have A. Is it going to be I-10 and I-50.1? Look those up in your books. So, is it going to be I-11.0 or I-50.1? Is it going to be I-11.9 or I-50.1? Or is it going to be I-50.1 and I-11.0? So if you don't know what these codes are, I'll just go ahead and tell you. I do have my book here. If I need to pull it out, I'll pull it out and go through it. But a lot of these codes I use on a daily because I do HCC coding, I family practice coded, things like that. So I kind of remember a lot of these from heart, by memory. So I-10 is going to be essential hypertension. So I-50.1 is going to be heart failure unspecified, I think. Oh no, unspecified is I-50.9. So I-50.1 is left ventricular failure. Let me make sure. Oh, I do not want to give any coders wrong information. I think I-50.9 is the one is unspecified for heart failure. So let me look it up. So I will not give you guys any wrong information. Okay, so HI-50 points. Okay, I-50.1 is going to be left ventricular failure unspecified. And I-50.9 is heart failure unspecified, like I said. Okay, thanks. Okay, so again, the question is, what codes, according to ICD-10 guidelines, describe a patient that has hypertension with left heart failure? So, your answer is going to be, da, 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 da. You may can't see this, but I'll tell you. Can you see it? Your answer is going to be I-11.0 and I-50.1. This is going to be your answer when a patient has hypertension with left heart failure. So you may be a coder now and you see this in coding. So if you see this, if you see a patient that has hypertension with left heart failure, then you know the appropriate codes is going to be I-11.0 and I-50.1. So I have it up here listed what it is. I-11.0 is hypertensive heart disease with heart failure. And then I-50.1, as I looked up, is your left heart failure. So let's talk a little bit about when you have hypertension and when you have heart failure. Even if the provider does not document that it's related to each other, it's kind of like a causal thing where it's like you have hypertension and you have heart failure, we just automatically link it together. Just like if you have hypertension and you have CKD or chronic kidney disease, you automatically link it together if the provider links it or not. The only time that you will not code it as linked together is if the provider has specifically documented that it is not a result of the hypertension. If they specifically say, yes, this person has chronic kidney disease, but it's not because of high blood pressure. But if they don't say it's not because of, then you're gonna already assume that the hypertension and the hypertension and the CKD or the hypertension and the heart failure is automatic, linked, and related. So I got some notes here that I'll read through that I wrote out for you guys. So like I was saying that I-10 is hypertension, just regular hypertension. But when you get to adding the heart failure or the chronic kidney disease, you're not going to use the regular I-10 anymore. You're not going to use it. So listen to this. Like I said, replay it, rewind it, pause it, take notes. I wrote this out. This is going to be very helpful guidelines when it comes to coding hypertension with chronic kidney disease and also heart failure. So coding for hypertension by itself is very simple. I just said this, I-10. Add chronic kidney disease and it becomes more challenging. ICD-10 offers a combination codes, offers combination codes that include the stage CKD 1 through 4 or stage 5 to end stage renal failure, which is 6 or just ESRD. So add heart disease, and there are combination codes for that as well, including codes to specify if there is heart failure associated with it. What if a patient has heart disease and CKD? There are combination codes for those too. Broken down, it becomes simple. The key is to know the stage of the CKD and to know the type of heart disease. I'll read that again. Broken down, it becomes simple. The key is to know the stage of the CKD. You know, there are stages 1 through 5, and then you're going to have your end stage renal failure, which is stage 6 or ESRD. So the key is to know the stage of the CKD and to know the type of heart disease. ICD-10 presumes a causal relationship. Just said that. ICD-10 presumes a causal relationship between hypertension and heart failure, or hypertension and heart disease, and between hypertension and kidney disease. These conditions should be coded as related, even if it's the absence of the provider documentation explicitly linking them, unless the documentation clearly states that the conditions are unrelated. Now, if it's unrelated and it clearly states that it's not related, do not code it together. If it does not say it's not related, assume it's related. Just like we have default codes. Just like if a provider just writes on a chart that patient comes in, patient has diabetes, I'm going to write the patient a prescription for insulin. Well, if the provider does not document whether it's type 1 or type 2, then us as coders, we know that the default code for diabetes is E1119 diabetes type 2. So if it's not specified in the chart, we don't have to ask the doctor, well, what do you mean? Is it type 1, type 2? You just said diabetes. No. When you see it, it's a guideline. That's why guidelines are so important to know, because you can mess up coding if you do not know the guidelines. So if you don't know, now you do. The default code for diabetes is E1119. If it's not documented by the provider, if they don't say which type it is, you automatically assume it's type 2. It's a guideline, it's a rule, that's how it works. So back to this. ICD-10 presumes a causal relationship between hypertension and heart disease, and between hypertension and kidney disease. These conditions should be coded as related, even in the absence of provider documentation explicitly linking them, unless the documentation clearly states the conditions are unrelated. Although combination codes link these conditions, additional codes for CKD and the type of heart failure are required. For example, if we're going to put hypertension and chronic kidney disease, there is a combination code. I wouldn't have to code hypertension as I-10. I wouldn't have to code chronic kidney condition as N18.9 is whatever the case. There's a code that goes together. So if a patient has hypertension and if they have chronic kidney disease, Then I'm going to use E1122. Let me make sure that's correct. Now I'm saying this off the top of my head because I deal with these codes. So if I'm not correct, then hey, maybe my brain is overloaded. But I can just almost assume that E1122 is hypertensive with CKD. Let's see. E1122. I'm correct. E1122 is type 2 diabetes with diabetic chronic kidney disease. You see how I said diabetic chronic kidney disease? It's linking it together. So I wouldn't use a separate code for hypertension. I wouldn't use a separate code for chronic kidney disease. I'm going to use this combination code. So if they have hypertension and CKD, I'm going to use 11.22, and I'm going to specify the stage of the kidney disease. I have to add that. Although I'm saying that the patient has hypertension and kidney disease, I have to specify the stage. And if the doctor has not specified the stage, then you would just go to the default code of unspecified, which is N18.9, unspecified CKD. So, for example, let's say congestive heart failure is stable. Continue beta blocker and ACE inhibitor. Those are medications. Cardiomegaly is stable. To follow up with cardiology. Hypertension, continue meds. Reduce salt intake. Increase daily activity. Moderate CKD, stage 3 on last visit. Advised to increase fluids. So, for the hypertensive heart with CKD, I'm going to use I13.0. And their code means hypertensive heart and CKD with heart failure stage 1 through 4. So you see how diabetes had the E1122 for hypertension and diabetes, heart disease and heart failure and CKD and they have the same combination codes in diabetes as well. So there are a lot of combination codes between CKD, diabetes, and hypertension. So don't forget to also add the stage. When you're going to code the combination code for chronic kidney disease, don't forget to add the stage. If you don't have the stage specified by the provider, then make sure you put the unspecified one. Okay, so we went over that one. So more guidelines. Now this is not just a hypertensive CKD diabetic guideline videos. I'm going to go over a lot of guidelines that you should write in your book. Now make sure you write in your book again. I'm not telling you because I want you to watch this video over and over and I want you to subscribe and I want you to like and I want you to comment. Of course, I want you to do that again. But that's not why I'm telling you this. I've taken my CPC. I'm telling you. This stuff I'm telling you in this video is going to be on your exam. And make sure you come back once you take your exam. Put your little comment down below and say, MJ, the coding coach, you were right. Because I'm right. That's why I'm the coding coach. So, the next guideline question is, what is the time frame defining when pain becomes chronic? Now, you know there's a difference between chronic and acute conditions. So, what is the time frame when you can say a pain becomes chronic? Anybody know the answer? I'll give you a minute. Ain't the song too long? Okay. So the answer is no time frame. If a person starts having pain today, it can be chronic today. There's not a specified amount of time. Oh, you have to have pain for 6 months. You have to have pain for 6 weeks, and then we're going to consider it chronic. Right now is acute. No. The doctor can specify it chronic upon just onset. So, and also while I'm thinking about it, and if I can think about the codes, I'll spit them out in case you use it a lot. Chronic pain is going to be G as in girl, G89.29. That's chronic pain. I use it all the time. Don't even have to look in the book. I'm sure it's right. But just if you want to double check me, Look in your ICD-10 book. G89.29 should be chronic pain. If it's not, drop a comment down below and I'm wrong, but I doubt it. I know that code. Okay. Another guideline question. Remember your guidelines is important. That's why I wanted to make a whole video about a few little guidelines. I know they're going to be on the exam. Writing your book. Again, write in your book. Write in your book. You know, if you have to make a little catchy song, I'm telling you to do it. So, according to the ICD-10 guidelines, what is the length of time for a myocardial infarction to be considered acute? Now, if you don't know, or if you skip medical terminology for some reason, or if you're not familiar, then myocardial infarction is just another word or a fancy word for a heart attack. Just like you're going to say doctor or attorney, or, physician, lawyer, interchangeable words. So if you see myocardial infarction, it's a heart attack. So the question is, according to the ICD-10 guidelines, what is the length of time for a myocardial infarction to be considered acute? The answer is going to be 4 weeks. This was actually on the exam. That's why I wanted to incorporate a lot of the questions that I know were on there, or as far as the replica questions that you read in your study guides or you going through with your instructor, and just you need to know this. So it's going to be 4 weeks. So 4 weeks is the length of time for it to be considered acute. Anything after 4 weeks, it's not acute anymore. Okay. So in ICD-10-CM, what condition is reported as the default code when the provider documents urosepsis or sepsis? I'm sorry. So I'll say it again. For as far as the ICD guidelines, what condition is reported as the default code when the provider documents urosepsis? Now, we talked about default codes where diabetes has a default code. If you don't document it, we know it's type 2. Well, urosepsis does not have a default code. The provider must be queried before an ICD-10 code can be applied. And if you're not familiar with the word query is, if you're a new student or if you're not sure of these terms I'm throwing out, query is just simply emailing or asking the provider, what do you mean? Can you be specific about what's going on with this patient? So that's the only thing I mean when I say query. That's like inquiry, asking them, what do you mean? Because you don't want to put anything on it assuming that you know what they meant, or assuming that they're probably talking about this or probably talking about this. No, you don't know. So make sure you ask. Okay. So according to ICD-10 guidelines, when a patient is seen for management of anemia due to malignancy, how is it reported? Again, according to ICD-10-CM guidelines, when a patient is seen for management of anemia, but the anemia is due to malignancy, which is some kind of cancer malignancy, how is it reported? I'll let you think about it. Because we have primary codes and we have secondary codes. Some codes go first, like the chief complaint or the reason why you're here. Those are your primary codes. So if a patient has anemia due to malignancy, how is it reported? So the malignancy is reported first, followed by the code for anemia. Code the malignancy first, since it was due to it, since the anemia was due to the malignancy. And I think I talked about this 3 times already in the video. I guess it's so important, to know this, because you may see a lot of charts where the physician has not documented or has not stated what type of diabetes this is. So this question simply says, when the type of diabetes is not documented in the medical note, what is used as the default code? So what's the answer? 1119, diabetes type 2. Excuse me, I'm a little sleepy too. That's probably what I'm looking like. Okay. But I wanted to get this video out, and I wanted to get it out tonight. I did not want to wait. I had a lot of questions about guidelines, so I wanted to make sure I got this done. So this is another thing I wanted to tell you also about diabetes. Um, when you're reading, reviewing, and coding medical charts with patients who have diabetes, look in the medication. If they are taking insulin, please use the code for long-term use of insulin. And that's going to be Z79.4, I think. Or maybe point 0.1. Let's see. I think it's Z79.4. But if they're taking insulin, if they have diabetes and they're in the office and they're taking insulin, and this is all a part about making sure you're capturing all of the codes. So make sure you're capturing that they're on insulin. Now, if they're coming in to the doctor and the doctor is writing them a prescription for the first time for insulin, then you're not going to use this code because this code is for long-term use of insulin where a patient is already taking insulin. Let's see. Let's see. I'm sorry. Thank you for being patient with me. Okay. So Z79.4 is long-term current use of insulin. So I was correct again. I'm just double checking for you. I just want y'all to feel comfortable with the coding coach. If I say it again, it's probably what it is. I wouldn't say it. So again, if you're coding a medical chart and the patient is on insulin, and this is not the first time where the doctor is writing the prescription. They came into the office, and when you read the medications, they're already on insulin. Make sure you code the code for long-term use of insulin. That way you'll be capturing all of the codes. Okay? Now, this is going to be tricky. This is going to be important. You're going to see this. Make sure you write this in your book. If you listen to nothing else I said in this video, write this one in your book. Okay. So what does the fourth character, oh, my TV just came on, sorry. I had it on pause. So what does the fourth character um, in the diabetes code indicate? What does it mean? What does the fourth character mean? Okay, listen. The fourth character in the diabetes code, it means any complication associated with diabetes. You know how we talked about E1122 earlier, which is diabetes type 2 with diabetic chronic kidney disease? Listen, E11.42. See, it's 5 codes. The fourth one, E11, that's 3.2. 4. So the fourth digit is going to represent any complications associated. So E11.22, the complication is CKD. Okay, so another example is E11.42, and that's type 2 diabetes with diabetic neuropathy. So the 2 and both of those, the 2 and 1 and the 4 and the other one, it represents the complication associated with the diabetes. So again, the fourth character in the diabetes code, it represents or it indicates any complication associated with it. This is a tricky one too. So when you're coding, whether it's ICD-10 or HCPCS or CPT, paying attention to detail is going to be very, very important. Please pay attention to detail. Read what the question is or read what the medical chart is saying and only document what it's saying or as close as possible to what it's saying. Don't add your own words. Don't take out your words. You're not going to be successful if you do. If it's not documented, it didn't happen. That's not it. And if you're not sure, always query the doctor before you make a code or before you code it and you're not sure. So when a patient has a blood test for HIV, that is inconclusive, which means it's inconclusive. We don't know, but you had a blood test for HIV and we're not sure after you got the results. What ICD-10 code is assigned? So I'll give you a few options. Let's do multiple choice. So you can break your book out if you would like and pause it once I give you all the choices. So again, the question is going to be, when a patient has a blood test for HIV that is inconclusive, what ICD-10-CM code is assigned? Will it be A, Z21, which is asymptomatic HIV status? Will it be B, Z11.4, encounter for HIV screening? Will it be C, B20, HIV disease? Or will it be D, R75, inconclusive laboratory evidence of HIV? D, R75. That's what I mean by sometimes people make coding more difficult and more complicated than it has to be. Listen, 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 listen. It's not that complicated. It's challenging. It can be difficult. But sometimes we bring the complications on our own when we don't read or we're not as detailed as we should be. So R75 is the answer, and it's saying basically inconclusive laboratory evidence of HIV. And someone probably would have put asymptomatic HIV, which means it's not showing up. Somebody might have went ahead and put HIV disease as the answer, or somebody could have put encounter for the screening because you did have an encounter for the screening, but we're talking about the inconclusiveness of the test. How would that be coded? Okay, another tricky one. And this is going to be the last one because I tried to make this video in about 30 minutes, so I'm doing really good. This is 33 minutes. So the last guideline question, or the last kind of tricky thing I want you to pay attention to, just is as the HIV question. Okay, I'm going to give you a scenario. A 45-year-old patient has been diagnosed with elevated blood pressure. The patient does not have a history of hypertension. What code would you use? So I'll give you some multiple choices. Break your book out. Let's flip through. So we talked about hypertension earlier. We said this simple. So what's the code for hypertension? And see, that's how you remember these codes because it becomes so repetitive. You see it a lot, you hear it a lot, you read it a lot, you use it a lot. So correct, I-10. So A, I-10, B, R03.0. Write it down and then look it up. C, I-13.0. Or D, I-15.0. I'll give you a chance to look. Jeopardy is my favorite song, so okay. So your answer is going to be R03.0. And that code is elevated blood pressure reading without diagnosis of hypertension. And that's exactly what the question asks. I-10 is hypertension. We're not saying it. We said he did not have a history of it. So we're not saying he has it. That's the wrong answer. I-13.0 is hypertensive, heart, and chronic kidney disease with heart failure and stage 1 through 4 CKD or unspecified CKD. We said nothing about CKD. Wrong answer. Or I-15.0, renal vascular hypertension. We said nothing about renal, which is kidney. We said nothing about renal vascular anything. We said the patient is 45. He got an elevated blood pressure reading without a history of hypertension. So all this stuff here, is extra. Wrong answer. And start using like processes of elimination when you're doing your quizzes, when you're doing your exam, when you're doing testing. Look for what absolutely is not the answer. And if you find what is not the answer, then you can kind of do process of elimination and say, hey, it's not this, it's between one of the two. And that'll save you a lot of time as well. My next video, probably, I'm not sure it's going to be a next video, but I'm definitely going to make it about exam tips. I'm going to tell you a lot of exam tips that helped me pass my CPC. And I'm going to come back with another story because I had to take it a few times, not paying attention. It's not that I had the answers wrong. A whole nother video, a whole nother story. Thank you again for joining MJ, the coding coach. I hope you learned so much in this video regarding guidelines. Please don't forget to like, comment, and subscribe so you'll be the first to know when I drop these videos. You can come on in and get some of this knowledge that I got to give, that I got to share. You can let me know what you think. So I will see you next time. Again, thank you so much for joining. See you later. MJ, the coding coach.